The downsides of bariatric surgery. So, overall, for most patients, bariatric surgery is a very worthwhile and fulfilling experience, and there are lots of benefits to both your health and your quality of life. But there are some downsides. I would say the biggest thing to bear in mind is that it's a significant lifestyle change. And I compare surgery to any other major lifestyle change like having a baby, emigrating, or getting a puppy. We think it's going to be absolutely great, but sometimes these changes can be quite immense and they can really challenge us. And we may, given the immense change, not be able to come to terms with the change. And sometimes we can't accept these changes. So they can have detrimental effects, especially on one's mental health. So the biggest thing to bear in mind is that if you do have any psychological problems in your history, then it may be worth talking to your mental health provider, or at least engaging them at an early stage. Because if your mental health were to deteriorate after surgery, then you may require additional support. For this reason, I would also recommend a consultation with a bariatric psychologist if this is available to you. There are also many good books available on the psychology of bariatric surgery, self-help books that are worth reading. So, from a physical point of view, after surgery, many people do suffer from hair loss. This is because the weight loss is so rapid in the first 6 months, and your body essentially goes into a state of shock in a similar way to the way in which people lose their hair after a significant traumatic event. But the good news is it does come back. It's important that you keep up with your multivitamins and your protein intake, and just be patient with it. And usually, the hair loss you will recover from that. The other downside is excess skin. Now, excess skin is a very individual thing. It's like asking people how they scar, and it's like asking 10 mums who have given birth, what are your stretch marks like? Some people's skin comes back very nicely, and excess skin isn't much of an issue, but it's an age dependent thing as well. So some people have a fairly good recovery as far as their skin is concerned, but for some people, the excess skin can be um, quite a hindrance, can cause recurrent infections and discomfort. And so you may require excess skin removal in the future after bariatric surgery. I suggest patients wait until their weight loss has plateaued, which is usually around 18 months before having their skin removed, and ensure that their BMI has stabilized. And then they can certainly have excess skin removal. Unfortunately, the NHS does not usually consider this as an essential procedure, and this is something you may need to seek privately. And I would recommend that if you do this, see a plastic surgeon who is very experienced at handling patients who have had previous bariatric surgery.